If you're a new mom about to become one, or just curious about how milk expression really works, you've probably run into the big question: hand expression or breast pump? Which one's better? The truth is, both have pros and cons, and what works best depends on your body, your routine, and even your stress level. But what's surprising is how much people don't know about hand expression and how powerful it can be when done right. Let's start with the basics. A breast pump is the go-to option for many moms because it's fast, convenient, and often seen as more modern. Whether it's an electric double pump or a small manual one, the goal is the same: mimic a baby's suckling to draw out milk. Pumps come with settings to adjust suction and speed, and they've gotten quieter, smaller, and smarter over the years. Some can even track your output through an app. But that convenience comes with trade-offs. For one, some moms find breast pumps uncomfortable, especially in the beginning. Suction that's too strong can cause pain, and incorrect flange sizes, something most people don't think about, can make things worse. Plus, cleaning all those parts every day gets tedious fast. It can feel mechanical, impersonal, and in some cases stressful enough to reduce your milk letdown. Now let's look at hand expression. It sounds simple, maybe even old-fashioned, but this technique has been around forever, and for good reason. It's completely free, doesn't require electricity or equipment, and once you learn the motion, it can be surprisingly effective. Some women actually get more milk with hand expression than with a pump, especially in the early days after birth when colostrum is thick and pumps aren't always efficient at drawing it out. Another surprising thing: hand expression can be gentler on the body. Because you're in full control of pressure and rhythm, there's less risk of damaging sensitive tissues. It's also discreet. No loud machine, no wires. You can do it anywhere with just a clean container in your hands. That makes it a great option for travel, emergencies, or even just when you're too tired to deal with equipment. That said, hand expression has its own learning curve. It's not as intuitive as it sounds. Getting the motion right takes practice, and in the beginning it can feel like nothing's happening. But once your technique improves, it becomes second nature. Some lactation consultants actually recommend combining both methods, starting with hand expression to stimulate flow, then switching to the pump. Others suggest finishing with hand expression to fully empty the breast, which can help increase supply. So which is better? If you're looking for speed and convenience, especially if you're pumping at work or away from your baby often, a breast pump might be the better tool. But if you're dealing with engorgement, clogged ducts, or need to express small amounts of milk, especially colostrum in the early days, hand expression might be the better choice. It's also incredibly empowering to know you don't always need a machine to feed your baby. There's also a psychological side to all this. Some moms feel more connected to the process when they use their hands. There's something grounding about being in full control of how you express milk. It can become a mindful moment, a break in the day instead of a chore. On the flip side, others prefer the distance a pump creates, especially if breastfeeding hasn't been an easy journey. Neither feeling is wrong. It just depends on your experience and your needs. What matters most is knowing your options. Many moms are handed a pump in the hospital and never told about hand expression at all. Others are never taught how to use their pump properly. If you're struggling with supply or pain, it's not about choosing one side. It's about figuring out what combination works for you. And sometimes the best tool isn't high-tech or fancy. Sometimes it's just your own two hands.